I think about all the issues about getting a child appropriately ready to be educated at age 5 or 6, and the kind of struggles families go through just to get food on the table, shoes on the children, medicine into the child if necessary, things like that. So those are some of the things that I think about that are really particularly critical in helping families find the best ways to make the best use of community services. I think there are a couple of ways of thinking about social determinants of health. One is when you add up any of the kinds of experiences families have that may be difficult for them or threatening to their health in different ways, first of all, they add up over time. And we know that many families who have one hit are likely to have multiple hits over time. And that's sort of a cumulative effect on the child's ability to grow normally and develop normally. So if you look at something like asthma, pretty common condition, we know that children who live in poorer circumstances have higher rates of asthma. We know that their asthma is often harder to treat. We know that they're more likely to end up in the hospital if they have asthma. And they're more likely to continue as young adults with respiratory difficulties from their asthma. So we know that poverty has a huge impact, and other social determinants. Poverty is probably in many ways the most important social determinants, have a real impact. Now the other thing that may be worth talking about is we know a lot more than we did 10 years ago about the physiological and developmental effects of stress. And when I say stress, I mean if you're hungry, if you have families who aren't really capable of nurturing you because they've got so many other things to worry about, whatever else. We know the cumulative effects of stress on brain function. So in other words, if children are going through bad times on an ongoing basis in the first 3 or 4 years of life, they actually develop physiologic mechanisms of how they respond to other things around them and become much less resilient, much less able to roll with the punches, much less able to learn new things as they get older because their brains aren't functioning as well as they could. This is permanent damage, in other words. Well, so I wouldn't want you to say that there's nothing that can be done. Okay, we kind of know that if a child has been in a difficult sort of circumstances for 10 years and then suddenly life settles down, that there are things that can be done, in fact, to help that child develop his or her skills more effectively. It's not as if you lose everything. But we do know that you have much higher rates of almost anything you'd be worried about if a child has been through really stressful circumstances throughout. And stress is often related to poverty.